Deep neck spaces are potential spaces formed by the compartmentalization of various divisions of deep cervical fascia of the neck. One of the deep neck spaces is carotid space. This is a potential space within the carotid sheath. This space is also known as visceral vascular space. It contains the carotid artery and internal jugular vein in addition to the vagus nerve, CNX. It lies posterior to parapharyngeal space, lateral to the retropharyngeal space, and anterolateral to the paravertebral spaces and medial to the parotid space and styloid process. The fascia has little areolar tissue and hence infections tend to remain localized. In 1929, Mosher called this fascia the Lincoln Highway of the neck because all three layers of deep cervical fascia contribute to the carotid sheath. This mental imagery was indicative of an important national event of his time, namely the creation of the first transcontinental paved highway in the United States. This was conceived 16 years earlier in 1913. Infections of the deep spaces of the head and neck have been reported since the time of Hippocrates, Galen, and other authors under the names morbus strangulatorius, synanche, Greek for suffocation, and angina maligna, too. Carotid space abscess is rare to see in this era of good antibiotics and early diagnosis and treatment. Clinically, these patients present with painfully enlarged neck mass, pain, dysphagia, fever, hoarseness, and dyspnea. Carotid space abscesses are rare to see in clinical practice. Padaguru, et al. 2, in his study on pediatric deep neck space abscess found that only one patient had isolated carotid abscess out of 100 deep space abscess they studied. Our patient apparently did not seem to have any cause for infection, but at the same time infections into the carotid sheath can arise from direct inoculation, such as from injection drug abuse or spread from adjacent neck spaces. The other causes are result of trauma to the upper aerodigestive tract or secondary to infection from surgical procedures like thyroidectomy. Less common causes are laryngopiaceals, thymic cyst, branchiogenic cyst, thyroid cyst, thyroiditis, and bronchial archanomalies. Our patient presented with painful neck swelling, fever, and dysphagia. The clinical features of such abscesses are painful enlarged neck mass, chills, fever, sepsis syndrome, erythema, induration and tenderness of the sternocleidomastoid muscle, nuchal rigidity, contralateral torticollis, and sometimes ipsilateral Horner's syndrome, and vocal cord paralysis. We did not see any complication in our patient, but complications of this abscess are well known. The complications of carotid sheath infection include internal jugular vein thrombosis, Lemierre's syndrome, which is more common in injection drug abusers. Internal jugular vein thrombosis presents with pulmonary septic emboli and, in patients with a patent foramen oval, with systemic emboli as well. The dural sinus is often also thrombosed. Another complication of carotid sheath infection is carotid artery rupture, which is associated with death in about 1/3 of patients. The internal carotid artery is most commonly involved. Rupture is often preceded by sentinel bleeding from the ear, nose, or mouth.